Thank you so much for inviting me, Dr. Heena Didi. I've actually been following your videos. I know how busy your schedule is, having your thesis in hand and then being in a final year. Despite that, she is very consistent in providing, worthy content in homeopathy, especially in YouTube. I've been following your videos, so I should take this opportunity to claim it also. So thank you so much. Today I'll be discussing a case of vitiligo. So you may all wonder why vitiligo. As a pediatric PGT, we deal with a variety of pediatric conditions on a daily basis. But today I decided to speak on vitiligo because I'm primarily very passionate on the field of dermatology and pediatrics. In fact, I based my thesis on pediatric vitiligo. As a result, I'm having the opportunity to treat many young patients with this condition. So my growing interest in this field had led me to talk about this disease today. We are also aware that vitiligo, though we see in adult patients and pediatric patients as well, the mean age of onset is around 4 to 5 years. As a result, the disease onset starts in childhood, whereas it may progress to adulthood as well. So this is such a condition where if we treat it early or control it early, the consequences won't be as devastating as it may be in adulthood. A 12-year-old female, the only child to her parents, came with a complaint of deep pigmented patches on her upper back, which had many confetti lesions around. I hope you people can appreciate. As you can see here, there's a central depigmented patch with surrounding confetti lesions and other small satellite lesions as well. So she complained that this condition was there since 8 months. So the onset was unknown, as in she doesn't know or they didn't pertain it to any kind of vaccination or injury, but it had started 8 months ago. And owing to this condition, she had sought allopathic treatment, and then she had applied topical medications for 2 months. As you can appreciate in this photo, you have small peck-like repigmentation. So that was pertained to the early topical medication she took. But as a result, it did not even get better. Like she told, the new lesions had emerged, and then this existing lesion has increased and in surface area and depigmentation on the other way. So she discontinued the topical medication, and her family friends had recommended homeopathy, and she had come to me. So this was in her exposed area of the skin as well. So owing to this condition, she has to wear collared clothes because she had a fear of getting bullied. So they had come in such an anxious state. So I had gone deeper into the case. This is the history. So there is no negative history of itching. There is no history of rashes, any exposure to chemicals which may lead to this depigmentation, or no history of burns as well. When I inquired further, I came to know that there is no family history of autoimmune diseases as well. As in there is no family history of rheumatoid arthritis, type 1 diabetes mellitus, or any thyroid disorders, or alopecia areata. So all these were negative. So we come to the next part of homeopathy case taking. Generals. So before I went to generals, in pediatric we always have to remember that intrauterine and the birth history is also very important. Coming to the birth history, she was delivered vaginally with a birth weight of 2.7 kg. The intrauterine period was normal. The mother adhered to the folic acid and iron supplements, and then the neonatal period was normal. She transitioned smoothly to the weaning period, as in she was exclusively breastfed for 6 months as well. The past history, as in there were no notable events in her childhood. So, and then she was immunized, routinely immunized under national immunization schedule with no adverse effects as well. Coming to the homeopathic part, physical generals, she has a desire for sour and fish, and then she does not like, or she does not relish, or aversion, let us say, to meat and milk. Perspiration was generalized, non-staining, non-offensive. Her thirst was normal, which increases in summer. Her bowel and bladder habits were normal and unremarkable. And then her sleep was refreshing, dreams were unremembered. Thermally, she was ambithermal, more towards chilly. And then coming to the mental generals. So when asked about her personality, both of them had jointly agreed on one point, that she is a bit reserved, but she has a select group of friends and she is very close with them. She is average to good in studies actually, and she is not lazy in studies, as in she is very sincere when it comes to that. Even her teachers had given good remarks in all kind of parent teachers meeting. And then her outdoor activities include playing, cycling with friends. And then she was also having anger from contradiction, as in if someone tells her not to do something, when she wanted to do something, she'll get angry. And when she gets angry, she does not shout or cry. Instead she just goes to some other room, alone room, and then she spends some time there, she'll get all right. So when we go further into that, the picture till now was general. I didn't get any qualified generals yet, in my opinion, apart from the desire and aversion. So when we go down further, the mother had told she does not like to wear any ornaments, as in not like the other girls, does not like to wear bangles or necklace. Her mother had told one thing, and she also agreed on that when she wears a necklace, she feels it is too tight or it is just controlling her. So she just throws the necklace whenever her mother offers. So that is one point. Secondly, when she is getting angry, there is one thing that she goes to another room and sits, but when she is emotional otherwise, let us say she is scared, or when she is excited, or when she is angry also, she says that she has flushes of heat, as in she feels she is having a heat sensation starting from her vertex and an entire head. So at the end of case taking, even you may even you may guess, the remedy of choice was sepia officinalis. So I decided to give sepia officinalis. I believe I forgot to tell one point. The first visit was on 30th May 2024, this year. So sepia was the remedy of choice, and the potency came. The next question was about the potency, what to choose. So in aphorism 279, Hahnemann in 6th edition of Organon of Medicine, he had clearly told that in chronic diseases, if there is no deterioration of important viscous of the body, you start with high potencies, because your small doses won't be able to overcome the natural disease. So keeping this concept in mind, I chose to give sepia LM first potency. And then I had advised her to come after a month, but she came after 2 months due to personal reasons. So just making sure, this is the first visit on the 30th of May. This is the second visit on the 20th of July. So as you can notice, there is a massive improvement, especially in the big lesion. So I am not joking, the mother literally came back teary-eyed that my daughter is getting better. Now she is able to wear clothes, normal clothes what another adolescent girl will wear. So all these things made me happy, and has the patients as well. That is the satisfaction we homeopaths would want to have. So as you can notice, this lesion, all these small lesions have been repigmented as PECs. So this is known as perifollicular repigmentation, which I will be discussing in the case discussion as well. The patient is under treatment currently, but this case is just to show you a single prescription without any invasive procedures can provide a massive improvement in a month. So in 2 months in first prescription. So this is a case I would like to discuss.
So thank you so much, Aparna. That was really interesting case, and the way you presented it was really impressive. So you being a pediatric, you're doing your PG in pediatrics, and as you mentioned that your thesis topic is also based on this, the vitiligo. So we would like to know more about how is vitiligo in pediatric cases usually. Okay, if you would put some light on this more.
Yes, Didi. Now when it comes to vitiligo, let me go from the basics. As we all know, there are various definitions in various literatures. Vitiligo is depigmented macules or acquired depigmentary disorder or an autoimmune depigmentary disorder. All these are right. But when it comes to the latest etiological hypothesis, they don't just restrict themselves to autoimmune. In fact, they add 2 more theories. First is autoimmune, where they pertain it to thyroid disorders in relation with other autoimmune. In my case presentation also, I had told family history of autoimmune. So this autoimmune theory is related to that. The second one is the cytotoxic theory, as in there is cytotoxic precursors attacking the cell. The third theory is neural hypothesis, as in segmental vitiligo. Now when I talk about segmental, I should be talking about the other types as well. This case what we saw is generalized vitiligo. We have lesions on either sides of the body emerging, so that is generalized vitiligo. And then we have segmental vitiligo, any specific dermatomal pattern. And then we have unclassified, as in very small lesions in the mucosal, oral mucosa, rectal mucosa, all this comes under unclassified. Now when it comes to pediatric vitiligo, we being a homeopath, we should also know the miasmatic presentation. So what did Hahnemann say in Organon of Medicine? Sora is the fundamental miasm. Every individual or everyone in the mankind has Sora miasm. Few years later, John Henry Allen, in his time period, we are all aware that he saw a lot of gonorrhea cases. As a result, suppression of gonorrhea led to psychosis miasm being manifested, secondary manifestation. So he in fact named most of the diseases of mankind as psychosis, due to psychosis miasm. Keeping that concepts in mind, when we look at the etiological hypothesis as well, it leads to cell destruction. So again it comes to syphilis miasm right now. In fact, vitiligo can be stable or active. When we say stable, last 12 months there is no activity, but then when it is active vitiligo, this lesion is increasing in size in the last 12 months. So that is syphilis miasm. Now we are also aware that in chronic diseases, as Hahnemann had told, in syphilis miasm, less suffering, less subjective symptoms. In such a disfiguring condition like vitiligo, there is no symptoms of the disease as such. There is no itching, no burning, nothing. So the patient, whatever the associated complaints will be after that, following that, probably due to low self-esteem. When we see a child with vitiligo, they'll always end up saying that I don't want to go to school because they have fear of getting bullied. Yesterday also I had 2 cases, today morning also the mother is telling that the child does not want to go out because he's scared or she's scared that she may get bullied. So that low self-esteem at such a tender age will begin, and that will lead to other complications like nocturnal enuresis or any allergy problems. So pertaining to all these factors, in a pediatric case, it requires even more vigilance to control it early so that it doesn't progress in adulthood. So miasmatic is done. Now coming to the treatment options in allopathy. So even patients ask us what kind of treatment I should go for in allopathy. Even for normal advice they will ask. So we have systemic medications, topical medications, and then we have phototherapy and surgical. Now in every literature I have read, even you can read, in every literature they have given like the treatment for vitiligo is individualized. So they have literally used the word individualized in every literature. That shows how dynamic this disease is. Though it is an extremely one-sided disease, it is dynamic in its own way. They have also told all these treatment methods have varying repigmentation in different individuals. Again, this is the scope for homeopathy. We give individualized remedy. So these are all certain things we must keep in mind. Okay, so just for educational purposes, I would like to show the various types of repigmentation we see in homeopathic treatment. Like though we have a variety, I see a variety of cases, I am just showcasing those for educational purposes. We saw this case, as you can see, the minute pecks, peck-like repigmentation. This is perifollicular repigmentation. And then just more examples of perifollicular. As you can see here, we have like dot-like repigmentation occurring in all the patients. Similarly, after a single prescription, you are seeing the peck-like repigmentation. Again, peck-like repigmentation. So all the entire concept is perifollicular repigmentation is the most common. So that is why even when we see follow-ups, when I get to see many patients, I am seeing repigmentation of perifollicular type. Again, perifollicular, if you can appreciate. Okay, so going to the next type, marginal repigmentation. As we can notice, the repigmentation is from the borders. So this is known as marginal repigmentation. One thing about repigmentation is there are patterns of repigmentation. Science says that there is melanocyte precursors or stem cells in the epidermis. So when you activate it, it will go and repigment, it will cause repigmentation. So those precursor stem cells are obstinate or quiescent in that stage, again psychosis miasm. So when you activate that, it's going to come to the depigmented area and going to cover it up. So this is marginal repigmentation, and then this is another case of marginal repigmentation. Other case of marginal repigmentation in the left eyelid, as you can appreciate. This is a diffuse repigmentation. So as you can notice, the depigmented patch has entirely become depigmented. This is a uniform repigmentation. This is again an example of diffuse repigmentation before and after. So if homeopathy can do wonders in such cases. Anyone can do.
Yeah.
So
And I would like to say that all these cases and pictures, like all are your cases. which
all
you
are my
treating.
cases.
So, and we saw repigmentation almost in all cases. That means it itself it's saying that homeopathy works.
Works,
and,
yeah.
Yeah, and about that individualization you said, right? So one more thing is what was your points for prescribing CPI in this case?
Okay. So the qualified generals what we got was, apart from depigmented patches being the common symptom of the disease, in mental generals we got does not like contradiction, gets angered when contradiction, seeks to be alone, or she's in fact she sought many times, she went alone when she was angry, and then she had flushes of heat during emotional excitement, be it anger, fear, excitement, anything. And then she does not like to wear anything around her neck, or feels any covering around her neck is too tight. Aversion to meat and milk. So all these generals was, led me to the remedy of sepia officinalis, the qualified generals.
You did do repertorized case, or it was based on your knowledge of materia medica?
It's purely based on knowledge of materia medica. I did not repertorize this case, but further on I had repertorized, and sepia was in the top 5 remedies of the repertorization. So after referring to materia medica, when we see the qualified general, sepia was coming. So I'm double confirmed right now.
And you know, sepia is some one of the medicine which is usually indicated in vitiligo cases when we go like in a way of therapeutic prescription in that way also. And other thing is, but you said that it was 2 months of prescription and then it was repigmentation, but you are still following up that patient.
I'm still following up to prevent recurrence.
Right, because in vitiligo it is not like you have cured the case in 2 months, okay, it can recur anyways. So what you think is how long if you prescribe, and if there is no more depigmentation, then you can declare that the patient is cured.
Okay, so about the recurrence. Now one thing about vitiligo in pediatric population, they have an active lifestyle, as in they go out playing. They are very clumsy because they are playing, learning how to be in the society. So they will have a lot of cuts and scrapes in their body. This will lead to new emerging lesions due to Koebner's phenomenon. We are all aware, isomorphic phenomenon, new lesions in psoriasis, lichen planus, as well as vitiligo. So as a result, I have several cases as well. After repigmentation, I am still continuing the medicine, because I am also advising the patient to have an active lifestyle. Don't restrict your child just in home. Let him he or her go out and play. So despite that active lifestyle, there is no new lesions in anywhere in the body. At least for 3 months, I declare it as at least fully cured or treated for that point. So that Koebner's phenomenon is one thing which I always keep in hand to show that this is not recurring. The treatment is permanent.
Fair enough, yeah. So thank you so much, Dr. Aparna. It was very nice learning, and the cases you have shown will give hope to many viewers who are watching this video that homeopathy does work in vitiligo, and get your child treated early, because early diagnosis and treatment will prevent all the further consequences. So that was really great.
Thank you so much, Didi. I should also be very thankful for inviting me here and giving me this opportunity. Thank you so much. Thank you.
So thank you so much, everyone. We'll meet again in next episode. Till then, take care. Bye bye.